Everything said on this podcast is entirely for entertainment purposes only. This is satirical and should not be considered clinical advice in any situation. Please use your own clinical judgment, using your own knowledge, expertise, and research. Consult with your local eye department if you're unsure, and always act in the best interest of the patient. Do not listen to the things that we say and take it seriously.
Hi guys, welcome back to another episode of Glasses Half Full. Thanks for joining us. Today we will be discussing nutrition and the role it plays in the eye health, eye care, all of that stuff. We oftentimes, I don't know about you guys, but patients talk to me and they bring up, oh, it's so good how much you can see with the health of the eye. I don't know if that's because they've just been told about OCT and all that, or whether it's general. And it's true. The eye as an organ, it's one of the few organs or few areas where, for example, you can see the blood vessels in and of itself without it being with an invasive method.
Yeah.
So systemically, the role nutrition plays is obviously very large, and that can reflect in the eye. Also, the eye in and of itself has a strong relationship with nutrition because certain things can directly, not just indirectly, but directly affect the eye. Can you tell us a little bit more about the eye food?
Eye food.
Eye food, the food eye, the connection between the eyes.
What the eye eats.
Yeah, exactly. Right. What do you feed the eye?
Feed the eye light.
His eyes on keto.
Oh.
Isaac. I think you mean how diet and the eye health are linked.
The
basically.
eye and the health connection, food,
Yeah.
diet,
Okay.
health, eyes.
So, like every other part of your body, your health is very directly linked to your diet, and the eyes are no exception. So, obviously, as optometrists, we all know the very normal kind of advice that we give to patients with like dry AMD, and we say to slow down the progression of dry AMD. Make sure you have your leafy green kales and your spinach and your tomatoes and your broccoli.
Because tomato is a leafy green.
Oh yeah, but tomatoes also is one of the foods with lutein, the other thing as well.
I didn't know
I don't think it has as much as the other ones. But it still has
that.
some.
There's some level of it. Yeah. 7 tons of
something
tomatoes,
in
you
there.
might get the same as
Yeah.
a bite of kale.
But another one is like water for dry eyes. Make sure you're hydrated. Things like that. There are very clear dietary advice that we
So
can
if
give.
somebody had wet AMD, you tell them to not drink as much water.
I said dry eyes, not dry AMD.
Okay. I know.
Dehydrated.
But yeah, so there's a very clear link to diet and eye health. There's a lot of, as I said, general dietary advice that we give to ensure that the health of our eyes are, if not maintained, then at least any problems that we have are not progressed as
severely as they would be.
exactly.
Yeah.
There's a lot of dietary advice that we give for systemic issues, or that we should be giving for systemic issues, that also have direct relation to the eyes. So one very clear example is your blood sugar. That would be one other dietary advice that you could, as an optometrist, give to your patients if you see signs of diabetic retinopathy.
Yeah. I often.
Because one of the main sort of with diabetes and diabetic retinopathy, the main indicator of how much it's going to progress, apart from the time that you've had it, the duration, which is just a correlation thing, generally, is the control of the diabetes. With somebody who could have had it for about a year would have much worse retinopathy than somebody who's had it for 30, just because of the poor control
Exactly.
and the fluctuations in the blood sugars.
Yeah, there is actually, I was looking at some studies earlier today. There are some studies that actually suggest that sodium intake, so high salt levels, has a correlation to cataract and risk of cataract. Yeah,
Because of the solubility of the water.
exactly.
And the
So
water moves
so
the
if you
lens.
have,
causes that.
it basically works that way. So essentially, you have a higher salt content in your aqueous humor, and there'll be more of an influx of sodium.
And that's clinically significant amount.
Well, I'm not sure if we can advise it to patients, but the studies that I've seen multiple, like a few studies, 2 or 3 studies that
We're going to link
suggest
them in
this.
the.
We can link them. I don't see why not.
You can find details of the study in our
I'll show it you. But
Oh, it'll pop up on the
That's-
screen now.
you know.
Editing work for you.
Um,
So is that to do with the water movement because of the gradient
Yeah.
content?
so when you have higher sodium content,
then the water
aqueous
from the aqueous, the liquid would move into the lens and cause the hydration in the cataract
basically, yeah.
faster.
So it
Oh, that's
works
interesting.
that way.
Clinically significant were the results.
Well, I'll look at the the one that I had. The main one that I looked at was clinically significant, but there's I think 2 other studies that suggest this as well. I have not had a proper look to give you the direct numbers.
It's
for
not
them.
college guidance yet, is it?
I don't think it's college guide, which is why I say whether you should be mentioning. the
What year
patients
was
or
the
not.
study?
So the study that I just looked at now is a 2014 study.
Recent.
Yeah, so it's not too old.
At college, you've had about 9 years to look at.
Yeah, but I feel like the reason why it might not be advised by college could be because it's not studied as much as the other conditions, and because
Yeah.
I mean,
It's
there
not a
isn't.
peer review study, is it? It's just a.
But
I
even
don't
then,
think
it's
so.
just it's.
But I think there's
I think it's obvious advice, isn't it? Like,
there was a
advice of-
randomized clinical trial on it which suggested it, but I just think that the amount of studies on this specific issue is just not enough to make a conclusive evidence.
That's kind of I've not heard of this before. I'm sure it does make sense that the cataracts are heavily influenced by the water balance
Yeah.
of the body, etc. How long was the study taking place? How many years, months, whatever?
Okay, so the study was a cross-sectional case study, cross-sectional case control, sorry. And the main study that I had a look at, this one was done in I think it was published in 2015. Yeah, but the study was based on patients from 2008 and 2011 in the Korean National Health and Nutrition
So it
Examination
was a
Study.
3-year study.
It's based on those 3 years,
Fantastic.
but the study was conducted in 2015 or
Yeah,
published in
yeah, but yeah,
2015.
but I'm just wondering about the duration.
Yeah.
How long? Because
And it
you
was-
have to let cataracts
It was
develop.
done on 12,693 participants.
Wow.
So it's not randomized controlled trial, but it's a study on this, of which 20% had cataracts.
Okay.
And they essentially just monitored the sodium intake and the sodium, and it suggested that high sodium intake, in accordance with low socioeconomic status, may affect the development of the cataracts as well.
So there's 2 topics.
There's 2 topics, so there's not enough evidence based in random control to say that sodium
Okay.
intake
Is the
will
isolated factor.
is an isolated factor,
Okay.
but there are studies that suggest that increased sodium
So
levels.
there may be a
have
relationship
a
with
relationship.
that.
Yeah, I think what we can all agree is that advising patients of a general healthy diet, including
But
balance.
regardless of whether it indicates or gives you an increased risk of developing cataracts earlier or at all, high sodium intake has other health problems
no,
as
of
well.
course.
So hypertension is a very common one,
And hypertension could cause many issues such as hypertensive retinopathy and
or even occlusions and things like that.
occlusion. Yeah,
So
puts you more at risk of aneurysms and things.
giving the advice that salt intake in your diet should be regulated, especially on your hypertensive patients, is not something that I would say don't do.
Of course.
But saying that if you reduce your salt, your cataract won't get worse, I wouldn't say that's
Yeah, don't
sound
say
clinical advice.
if you have less salt, I promise your cataract will recover.
I will
and
guarantee
you will heal this cataract. Don't say that.
But
By the way, there are no studies to suggest that cataract can be reversed.
yeah, there was that last point. It's a good example of the difference between the direct relationship with nutrition and eyes and the
Yeah.
indirect relationship.
Exactly.
Sure, salt might not have as direct a relationship as some of the studies may suggest,
Yeah.
like the salt content and the cataract.
Yep.
But there's still a very apparent and deep indirect relationship affecting the systemic body, hypertension, that affecting the eyes, and so on and so forth. You did mention the big one. When you think about nutrition and the eyes, the main direct advice that we often find ourselves giving is the
Carrots.
Yeah.
For the vitamin A.
How, is that the main one? Are we in 1940s?
Carrots.
Yeah, in passing, perhaps for me at least, it is the antioxidants, and of them, the lutein and zeaxanthin,
Yeah.
clinically significantly proven to help slow down the progression of AMD.
Yep.
So yeah, the lutein and zeaxanthin, and zeaxanthin, it's proven up to 25% to help prevent the progression of your dry AMD.
Yeah.
These supplements aren't cheap, I'll be honest with you, but
How much are they?
I think the ones that the last time I saw them in the store that I was working at is for about a 1 month supply, about £50. So that might be a particular brand, that might not be the general one, so on and so forth. But to be taking that for years and years, for
That's a lot.
obviously you can, but
£600 a year.
it's quick maths.
Is that right?
But the thing is, dry AMD is a non-reversible eye condition. So
Yes.
25% and up to 25% reduction in a non-reversible eye condition
Is
at £600 is that unreasonable, to be honest with you? Considering, okay, if they're not smoking, if they've got the UV protection, what else can they do?
This is for AMD.
Yes.
I think for patients,
UV protection is
there's a
disputed
level
as well now for AMD, not for cataract.
So even less. So if they're not smoking, what else can they
Yeah, I mean UV is always good because cataract and other things as well. But for
do?
AMD,
Yeah, I mean the UV is not good for anything.
unless it's been disproven now. But from what I remember, UV was an inconclusive result. Not to say that it made it worse, but the effect of UV isn't as effective as we thought we once was, basically.
Yeah, I think another aspect of it as well is for somebody with dry AMD to have an irreversible age-related eye condition. There's an element of control. I think this might be a really abstract point, but for a patient to feel like they have some control in their eye care and they can feel as though they're making a positive step towards looking after themselves. For some people, I think
that's a very good point.
Is a big factor.
It's a very good point.
Because there's not much else you can do, is it? Apart
exactly.
Because it's going to get worse anyway. So
instead of just sitting back and letting it run its course, you can actually do something about it. I don't feel that it's emphasized enough. I mean, every time I will tell my patients, leafy green vegetables, eat your kale, eat your spinach. Most of the time, it's like, oh yeah, I already do. Probably not enough. But the additional supplementation of it, just to eliminate that from being even a factor. I know I will be, or I know I don't recommend it probably as much as I should. I probably should encourage the supplementation use of it, because even though yes, it is present in multiple foods, apparently even tomatoes, but even though it is present in multiple foods, you're leaving it up to chance you might not be getting as much as it could be beneficial for you. Yeah. So the additional supplementation is
you'd rather take too much of it than too less.
Exactly.
Yeah.
Exactly. Especially when it's something like the irreversible damage to your eyes. Not just lutein and zeaxanthin. I know those are the stars of the show. I know those are the ones that we're taught about the most. But even other ones.
It's because it's the most effective.
Yeah. But like I'm not downplaying that at all. But we don't really speak about the other ones. You know.
I think the only other one that has a similar effect is the component as beta carotene. I'm not sure if you've heard of it. It's probably stuck in the uni days. But one of the reasons why that isn't as sought after is because there was a risk of lung cancer with some patients. I think it was more the smoking patients. So when it came to supplements, they found that lutein zeaxanthin as nutrients had similar efficacy, but didn't pose that risk. So they
less problematic.
Yeah, so less problem. I think that was in the AREDS too that they did. They found that out basically.
Interesting.
So they decided to move.
So supplementation of
those, yeah, supplementation of those.
Okay.
Yeah.
But not in its natural forms.
I'm not sure, but I don't think because your supplements have a high concentration of that amount. Do you know what I mean?
Yeah, it's overdosing.
Yeah, you're overdosing on that.
Vitamin A.
Yeah.
It's but even not vitamin A or lutein zeaxanthin, even the Blue Mountains eye study. It found that vitamins C for Charlie and E for Echo.
Yeah.
Found that those two vitamins were associated with low risk of cataracts and AMD.
Okay. Yeah.
In general, my advice regarding cataracts is often a bit of don't really worry too much about it. Everybody
We're gonna-
gets it.
yeah.
We'll treat it when it comes to it. It's the most common eye operation in the UK.
I tell a lot of my patients it's a when condition rather than an if condition. And that always calms them down because I'm like, it's more like a when you'll get it rather than an if you'll get it.
Absolutely. I did that. That's something I advise all
Yeah.
patients. It's only a matter of time
Yeah.
before you get cataracts. It's I'd say it's closer to something like presbyopia than it is something like AMD. So with cataract, because it's such a treatable, it's the most common eye operation in the UK.
Yeah.
Because it's such a treatable thing, it's often not worth it for the quality of life improvement. Okay, wear your sunglasses every time you step outside, eat this, do that.
I mean, it's worth it.
For what, an extra 2 months of delaying a cataract operation?
But no, but it's worth to take measures to maintain as much eye vision as much as possible. But to say, let's say, like
the cataract operation, sometimes it's just going to be an inevitable thing. If they're 6'7", last 2 years ago they're 6'6", and they're 62, and you can tell.
No, I
that's
definitely agree with that. But
for-
even in that 2 months that you get as it's developing, you're also going to get an increase of specific symptoms like the glare that you get and the reduced contrast. So there are
Come 2
different.
months sooner.
Huh?
Come 2 months sooner.
Yeah,
My point isn't to not advise care.
Yeah.
My point is that there's a difference between the advice you give for a treatable condition like cataract and the advice you give for something like AMD,
Okay.
where it's not a treatable condition. I'm
Yeah,
not
yeah,
really
yeah.
telling them, I'm not
As
giving
in
the
it's-
same importance to vitamin
It's
C
less
in
of
the-
an imperative for you to tell them to wear your sunglasses for cataracts
Yeah.
rather
It's
than
like-
being like eat kale for your
And
dry
that
AMD.
gets back into why I think vitamin C and E or other ones aren't quite as much of superstars as lutein and zeaxanthin. Vitamin C and vitamin E might not be as well known as other vitamins.
Yeah.
Tell us the name of a vitamin that does have a known name.
So vitamin A, or retinol, or beta carotene, however you
Yeah.
want to call it, is it's the top dog of the vitamins. That's why it's got the title vitamin A.
Yeah.
And that obviously binds with opsin.
Yep.
To form rhodopsin, which is a protein that is
Transformer.
robots in disguise. Is a protein that's used in rods in the pigment photoreceptor cells around the periphery of the eye that are useful for night vision, which is why you get the expression of eating carrots is good for your sight, because if you have an abundance of vitamin A,
That's not why carrots.
if
have
you
that.
have an abundance,
Why are they good for your sight then?
Because of the British propaganda. They developed radars,
Yeah.
and the Germans didn't know how they were seeing them, and they were advertising that because they had lots of carrots, which could be good for night vision.
Because they were shooting them in the night.
Yeah,
Oh,
they're
like,
radars.
wow.
But
Yeah, well, why do you think they picked carrots from? They could have picked tomatoes, but they picked carrots because of the vitamin A,
Well, yeah.
okay, but that's not
retinol,
no, but because of
opsin,
the
rhodopsin,
World War II
rods.
radars.
improved
Yeah,
peripheral.
but the phrase "carrots are good for your eyes" came from that.
Came
Of
from
course,
propaganda.
yeah.
But
I
the
don't care about
science behind it
propaganda.
is what you're explaining.
Yeah, I'm explaining the science. I'm not here for propaganda. I'm here for
Because it's still not wrong. Because that's like carrots improve your night vision. That's what he's trying to say.
Yeah, that's why.
But that's not why they're known. Okay,
Yeah, I don't care why they're known. I care what the facts are.
okay.
And
Alright.
the facts are is that vitamin A is the alpha vitamin because it's for night vision,
Yes.
Nice.
and that's all you need to know about that.
I don't know about anything, to be honest. That's kind of... So we've covered carotenoids with lutein, zeaxanthin. We covered vitamin C, A, E.
Omega 3.
I mean, I'm a vitamin C kind of guy, but
Omega 3 is a good one. Omega 3.
okay.
Yeah.
Tell us more about the third omega.
So the third omega is better than the first and the second.
Who cares about those? We don't even know what
I know,
Have
right?
you heard of omega 2? No.
So omega 3 has, I think, in conjunction with like vitamin A, lutein, xanthan, it's probably the other more common micronutrient that we relate to eye health. So one of the ones that I think most of us know about is its effect with dry eyes. Some studies that I was reading upon shows an improvement with dry eye symptoms. So one study didn't find any clinical significance, but there was symptomatic significance. So patients
Patients
reported
sure.
that their symptoms.
Is that to do with the oil? in
I'm
the
having,
lithium film?
I think it's related to like MGD relation, because another study that was in relation with omega-3 in dry eyes showed an increase in tear breakup time, which
Okay.
obviously if it's
Okay.
a lipid related thing, then that would also obviously be affected.
Yeah, that would line up.
Makes
So I
sense.
wouldn't say it's far-fetched to say that that's the cause
Okay.
for it, but I don't, there's no study that I've read that says why it's happened.
Of course, yeah.
Another
This is
effect
not
that I think
medical advice.
no, another effect that I've seen in a study is its effect on cataract. So there's a couple of studies on this. So one of the studies was done on the nurses, based on the nurses' health study, and it was the high intake of omega-3 in conjunction with eicosapentaenoic acid,
No, say that 3 times.
EPA, and
Oh, there we go.
docosahexaenoic acid, I think,
Rolls off the tongue.
DHA. In conjunction with omega-3, they showed to have a 17% and a 12% decreased risk of cataract, respectively.
Interesting.
So with vitamin C and E and reducing your sodium intake and taking some omega-3s with DHA,
You don't get cataract.
you'll save an extra 3 weeks off your cataract referral.
However, there was another study
That's fine.
that showed that it increased the risk of cataract
Increase the risk of cataract.
by 2.2-fold.
I mean,
This is-
whoa, that's
Don't
that.
worry
Yeah,
about
of
this.
any cataract with
Yeah,
those
that
with
10
high
cents.
intake. But I'm suggesting maybe the intake of omega-3 might have been different.
Did I mishear you? Did you say 2.2 fold?
Yeah,
So over doubles the progression
yeah,
of cataract
that's what it said on
compared to a.
Says that one guy.
What does
it.
he know? You don't need a study on it.
But the overall study suggests that maybe omega-3 does have a positive effect on cataract,
It's
from what I've read.
2v1. It's a
On
split decision.
purely based on.
I mean, let's call that inconclusive.
It is. It's
Until,
definitely
until the
it's,
call puts it down on paper, we're calling that inconclusive.
it's definitely inconclusive. However,
Fish is good for
the
you.
mechanism that's been proposed, basically how it works is that it increases the vitamin E, which indirectly suppresses the process of oxidation in cataracts.
Okay.
That's
You mentioned vitamin E, I'm a fan.
so
I just heard vitamin E.
the
I
mechanism.
heard omega-3 vitamin E.
The mechanism that's suggested is that omega-3 has a relation in increasing vitamin E, which indirectly could suppress the oxidation that causes the cataracts. If that makes sense.
Okay, so I'm avoiding omega-3.
For cataracts.
Yeah,
Yeah.
exactly.
But
There are other-
take it for your MGD though.
I mean, I take omega-3. It's fantastic for you.
I think another thing that omega-3 I think has been discussed is its relation with macular degeneration. Have you guys heard of that?
No.
No. There are studies that have been done to see whether it has a similar effect. Any studies that suggest that it does, nowhere near as leading to xanthan.
Yeah.
They are the goats.
Some
They're
studies
the
say
superstars.
there's no studies say that it makes it worse, but there are some studies that say that it
You've really
has
found
no effect.
every single opinion on every single.
Yeah.
Got a lot to the table. Omega-3 might not make your macular degeneration worse. It also might not make your myopia worse. It also might not make your whatever worse.
Earache.
Yeah.
But actually, sodium there's
Tell me something else that omega-3 might not make worse. Please, we really value.
But omega-3 though, the fatty acid, there are some studies that say that it does have improved, like a significant, in the term being that it has an effect in slowing down the progression. But I would say that's also inconclusive because there are other studies that say that has no effect whatsoever.
After that roller coaster of inconclusivity, I think I'm still going to be taking omega-3s. I'll have to listen to that a few more times. Get the views up on that podcast. But tell us what we should be avoiding for the sake of our eye health and systemic health.
Well, avoiding. It's not really a case of avoiding. It's a case of balance. So, I mean, anything is bad for you when it's out of proportion, and anything can be good for you in the right proportion.
Anything can be good for you in
Anything
the right
short of
proportion?
eating like glass.
Okay. There's not a right amount of glass.
There is no.
The right amount is
I
zero.
thought I was onto it. I thought I was onto something.
Or dish soap,
Oh God!
laundry detergent
Just stop!
powders,
You're making my day worse.
Tide pods.
Tide pods, bleach.
Right.
These are things you should not be eating. This is not clinical advice. This is just common sense. No, I think a lot of what I say to patients is, you know what's good for you, you know what's not good for you. I'm not going to baby you. I'm not a nutritionist, but you know, eat things in proportion. if somebody's diabetic and they, the main thing with diabetes is the control. Obviously, the
Blood
duration
sugar.
has an effect on it, but that's more of a correlation.
That
I
is
think
one of the big
I
ones.
find the control of it is a much bigger factor, because if somebody could have been diabetic for like, what, 6 months, and because of the poor control, they've got far more advanced retinopathy than
Yeah.
somebody who had it for 20 years, for example, who's just keeping a good control of the sugars. So anything like with diabetes, I would obviously say to control the sugar intake and to make sure the insulin and the medications are up to date, and they're going for regular reviews, regular attendance of the diabetic screening, and just keeping the sugars under control. If they have a good idea of what their sugars are like and what their blood levels are like, then likelihood is they'll have a better control of the diabetes and the diabetic retinopathy than somebody
Yeah.
who isn't keeping a good control. I think for the average patient, I wouldn't generally give them nutrition advice unless there was things like AMD or cataracts, in which case I would say, you know what's good for you, what's not good for you. Smoking and these things will make it worse, so stay away from smoking, stay away from uncontrolled poor diet and excessive oily, fatty, greasy food. Make sure you do eat what's good for you, as you'll surely come on to. So Osman, what is good for you to eat? What's the count?
So I think we've covered a lot about the stuff that we should be targeting. The leucine, zeaxanthin, the vitamins A, C, and E, the omega-3s, I think. But yeah,
if you can
Very
if
possibly.
you can figure out if it was a positive or not, let us know. We don't.
Important for example, dry eye, stay hydrated. You know, that's a big one. Keep your glasses always full. Considering that's that's one of the most common presenting symptoms. I find I have a bit of dryness here, a bit of watery here and
Yeah.
there. Make sure that you are staying on top of your hydration, dependent on the weather, of course. The supplementation is just that. Supplementation should be supplementing you or your patient's diet. It shouldn't be, substituting the meals. So it doesn't, or it's not optimal to be leaving out all the leafy green, kale, vegetables, tomatoes, whatever.
And then popping in AirEds.
Exactly.
No tablet will replace a good, varied, balanced,
Well-balanced.
healthy diet.
Yeah.
Plenty of water, rest, and an
Rest.
occasional oily fish.
What are they having the flu?
No, yeah.
Rest, yeah.
Rest is important.
You need to
Rest is
take
very
regular
important.
breaks on VDU and close work.
Oh, that kind of rest. I
Or
think
in
then like
general, even we just spoke about how important systemic health is on the eye.
yeah,
And systemic body is heavily dependent on rest to recover. And
Definitely,
to
yeah.
things. So yes,
it's
rest
just
is
it's
important.
just I'm not arguing with the point. I'm arguing with the way that you said it.
I just meant look after yourself.
Yeah.
But that's just it. Everything we just mentioned is like they're small, little, nutrients, vitamins.
It was quite niche.
What was niche?
What we discussed.
Yeah, no, absolutely. The things. Well,
Yours were
Mine was niche within.
extremely niche.
but the point I was making is that it's not just that. Systemic health is a large part of it. Make sure you are eating, a well-rounded diet, and you are taking care of your systemic body and all that. And that goes beyond, just what you're eating. But yeah, supplementations are still good. It's hard to get as much as you need on a consistent basis. So tell your patient to target the main foods, the oily fish, the fruits and vegetables, or well-rounded diet. Stay on top of their hydration, and on top of that, supplementation doesn't hurt.
No.
Thanks for joining us this week, and hope to see you next
See you later.
Comment your favorite vitamin.
week.